Good afternoon, everyone. I hope you're doing well. I was kind of told initially that this was going to be a lunch and learn session. So hopefully the last lunch and learn has carried you over. This is the dessert and learn. For today's session, we're going to be talking about the use of dashboards during the coronavirus. Of course, my name is John Joseph. I'm one of the public safety GIS specialists here at Datamark, and I'll be moderating today's session. Before we get started today, I want to make sure I did just a little bit of housekeeping for you. We are going to have everyone muted that's on the lines. However, you can, just by floating yourself over the bottom portion of the screen, be able to submit questions. We'll try and make sure we can answer all of your questions at the end of the session rather than during the time when Anthony's talking. Of course, we run out of time, we'll definitely try and respond to you by email or some other means. With that out of the way, I will make sure to introduce here, we have Anthony Puso. Anthony is a senior account executive with Esri. He's based out of Washington, D.C. He works specifically within the state and local government practice and has over 15 years of experience in the information technology industry. With that, Anthony, I'm going to hand it over to you.
All right. Thank you. Appreciate it. How's everybody doing today? Interesting times we are in right now. So thank you for having us, Datamark. Thank you for inviting me to present today. It's been a kind of a crazy couple of weeks here. And so what they asked me to do here is to share some experience of how people are using GIS and dashboards and information products for a coronavirus. So my name is Anthony Puzo. I'm based out of our DC regional office. So I live in Falls Church, Virginia, which we were just put on a stay at home quarantine till June 10th. So I'll have plenty of time to do more of these if you're interested. So what I'm going to go through today is a little bit about what Esri offers, and then show some experience and some examples about how our user community is meeting the demand of the marketplace for information products to be able to respond to this pandemic that we're dealing with. So I'll just go ahead and get started. I recently watched the new Mr. Rogers movie here recently, and I was a big fan growing up, and now I have my kids watching them. And I always loved this quote by Mr. Rogers that, when I was a boy and I would see scary things on the news, my mother would say, "Look for the helpers. You will always find people who are helping." And that bodes really true today, as I know I'm trying to convey the message of what's going on in the world right now to my 7 and 3-year-old, which you'll probably hear in the background at some point during this conversation. But in my 12 years of working at Esri, the GIS community is full of helpers. In the midst of this chaos swirling with responding with this coronavirus, I see everyday examples of the GIS professionals and IT leaders and the public safety folks. A lot of the folks on this call today, I see a lot of familiar names on here. Public health analysts in government, they're providing excellent communication products and timely data services and really top-notch analytics to the public and to our leaders that are helping making a lot of these decisions that we're going through today, like a stay-at-home quarantine until June 10th. So thank you to all the people behind the scenes making this happen. You are truly an unsung hero in this whole thing, and so thank you for that. At Esri, you heard a little bit from Francis this morning about who Esri is and what we do. We are a company full of helpers as well. Our disaster response team, we responded to many events over the last 20 years, dating back to 9/11 and hurricanes. And I know I've been involved in a lot of hurricanes down with Irma and Harvey and others. So far this year, we've hit 5 times the amount of disaster response calls that any other year that we've had. And that includes 2017 when we had Irma and Harvey. That was our highest year ever. So we're not even in April yet, and we're already 5 times the amount. So it's going to be an interesting year. But what we're offering is a complimentary software to anybody who needs the apps and data services that we provide and the things that you'll see here. And this was amplified through FEMA and a press release over the weekend to every emergency management director in the country talking about this. So if you need help, it is there. We've organized a lot of our resources and even requests to assistance in our COVID-19 GIS Hub. We've curated a lot of customer examples, so I couldn't go through all of them today, so you'll be able to see those in the hub here, and resources, data sets, all kinds of stuff. What my team has been doing, and the state and local team and the public safety team and the health team at Esri, what we've been doing over the last month or so is really working with our customers, state and local governments, health officials, law enforcement, emergency management groups, our GIS folks, and really working with them and making sure they're looking at these 5 proactive steps. And these 5 steps really help them create an instant picture about what's going on in the organization and how can they respond. And so these 5 steps really include, 1, just simply mapping the cases, right? Where are things happening right now, and what's going on at this in real time. Number 2 is mapping the spread. So looking at those cases and looking at over time and seeing how that infection spreads over time and see where you might want to target for interventions next. 3, mapping vulnerable populations and taking those cases and integrating that with demographic information, socioeconomic information, age, income, whatever it is that you can get your hands on to look at where at-risk populations are, and I'll show you some examples of that. Number 4, mapping the capacity, seeing where you have facilities, resources, things like hospitals, grocery stores, all the things that are necessity right now, essential items in your community. What's the capacity of those? And there's some really great examples of showing that. And then how to communicate with maps, right? Maps are a great way of telling your story. They make it relevant to the person. You know, anytime you show somebody a map, they always want to see where their house is and how things are related to them. So that's exactly what they're going to do with these maps and dashboards and story maps that you put out is, you know, people are going to see how that relates to them and what's close by. So communicating that really makes relevance in that. And really the 6th one that's not on this is really mapping that out with economic factors. And I think that's going to be the growing one next, of seeing how, you know, we're responding to this issue now, and then what's the economic fallout from that. And that's really the next step after these 5 steps here. So what I've done is I've kind of just outlined some examples here of that align with those 5 steps. So 1, mapping the case. This is a dashboard built by Johns Hopkins University. You probably have seen it. It's been all over the news. They started this project about early January, looking at when the situation really started rising up out of Wuhan, China. And I think some of its charm is really in the simplicity of this dashboard. This is hosted in Arcgis Online, made with an operations dashboard app. And what this does, it really just coordinates total confirmed cases, case by country, which we've taken the lead now, and then total deaths and total recovered. They are getting an enormous amount of use out of this. They're seeing, and this screenshot down here in the bottom left was taken a few weeks ago. They're getting 1.2 billion requests a day, which is enormous scale. At Esri a few years ago, when Pokemon Go was the hot item, somebody put out an app that showed where all the Pokemons were, and that was our biggest, most used application ever. This has far surpassed that, and is kind of one of the faces of this epidemic that we're facing right now. A couple interesting developments on this is now they're offering county level data. So they were just offering states. And this is a little bit different than the WHO dashboard in that they are including a lot more US data. So they were including state data, and now they're including down to the county data on this. And then some of the states are actually going down a little bit further now down below. So this is a great example of just kind of mapping the cases. I personally work a lot with the state of Florida. They've been doing some amazing work down there on mapping the cases down in Florida. They're using something called Experience Builder, which is actually a new application from Esri. This provides a really nice interface to create what you want. So this is the next version of Web App Builder. And it can build out a nice little interface here, great for mobile applications. A couple interesting things that Florida is doing is, of course, they're mapping out the cases, but they're also mapping out the testing results that they're doing here, and they're going by county. So they have a lot of information here that they're putting out. And the GIS team there is doing an amazing job of responding to the questions from the governor's office on down. And I mean, this is really like a really small shop within Florida Department of Health that's doing this. So you don't have to have a huge team to put out these kind of products. You can do this with some resources you have on hand. Another one is, and this isn't actually a brand new application. This is from the state of Arizona. This is an ESF briefing book. This is something that the governor's office and leaders have been using over the last couple of years, I think. This is all organized within a story map here that you can see different applications here. So this has a story map in it that shows, you know, what's going on the daily operations. And then it has tabs across, and they're including a lot of the COVID-19 information here right into Arizona. So these are live feeds that can go right to an executive's iPad if they want. So you can see all that information right at your fingertips. So really nice application there. And this is a trend we're seeing is kind of building out these web applications to really give that timely information to executives, internal and external. The second one is really mapping the spread. And this is where you're taking that case data and you're looking over that over time to really kind of see where the infection is happening, where it's growing. A really nice case of that, and I don't know if this is going to work right now in the story map, but there's a story map here from our Esri story map team called Mapping the Novel Coronavirus Outbreak. And this really kind of gives more detailed information about how the virus has been spreading over time, based in China and then overseas. So this really does a really nice job of kind of outlining that. There's other ways that you can do this. This was a project done by one of Esri's solution engineers. He's out of the federal team, David Attaway. This is an insights dashboard that's looking at cases over time and how those relate to one another. So this is using Insights for ArcGIS. This is a data exploratory tool where you can build in maps and data feeds, graphs, charts, and link analysis charts so you can really explore that data. Sometimes this is a public product, sometimes it's not. Sometimes it's for the analyst to really explore and see what's going on in that area. But this is some great data. Some of the stuff is over my head, but great way of kind of laying out this data and looking at data over time. Another one is from the University of Virginia dashboard. And what this is showing is a time slider in this, and this is actually just a GIF laying this out, but showing how the virus has spread over time. So this time slider up top. There's a link to the dashboard that I'll be able to share out this whole story map with anyone afterwards that wants it. So you can get all these applications that are in here. But this basically just shows effect over time, you know, where it's growing, where it's going next, and maybe you can anticipate where it's going to go in the future. So that's kind of mapping the spread. And now what we want to do is take those cases that you mapped, look at that information over time, and then mash that up with other information. So a couple things that Esri provides is our Living Atlas of the World. And this is a free resource to anybody that wants to use it. And what we do is we curate a lot of the data. So demographic information, health indicators, business information, base map information, imagery. We have stuff that we get from some of our partners like Digital Globe and others. And then we have some from our user base. So state and local government contribute to our Living Atlas. So this is a great resource. And this is provided with the platform at your fingertips, so you can add this to any of your web maps or applications. Nice part about the data that you get here is that it's not just a static or graphic. You actually get the features in it, so you can interact and do analysis with a lot of the features that are in this. This plays a key role when you're trying to map vulnerable populations, because you need that data to be able to build out things like this. Like this is a nice infographic. This is a free product that Esri put out. Infographics are normally bundled with our Business Analyst Online or Business Analyst Extension. But what we've done here, this is a free application anybody can go to, and we have 3,172 counties here curated that you can search by state, and then go to any of those counties here, and you get a really nice infographic, which is the demographic information, which all has drill downs for each one of these. And then what we've done here is put in the COVID cases, any deaths, and then we have some data here that I'll highlight in a bit from Definitive Healthcare on hospital beds. So you can match that up with some of your demographic information, population over 65, diabetes rates, and this becomes a really nice information product that you can share internally or externally with anybody who needs it. Becomes a really nice piece there. So some of the other data products that we include in here, this is back in the hub. We have a partner called SafeGraph. So they're populating points of interest. So if you're looking for data on pharmacy locations, hardware stores, Target, Walmart locations, any of those really like high accuracy point of interest, we have a map service here that has all that data at your fingertips. That hospital bed data is in here. The CDC Social Vulnerability Index. We've also curated some cell phone information from Unicast, which gives scores for each county on social distancing. So there's a lot of information here that is at your fingertips that you used to have to go and really dig for and get access to, and now this stuff is readily available. Here's a little bit more information on mapping your capacity. So we've kind of mapped the cases. We looked at trends over time. We've included that with some demographic information. Now we're looking at our capacity and what we have available to really meet the demand. A few weeks ago, our chief medical officer partnered with Definitive Healthcare, which provides total capacity hospital beds for the US. This is a data layer that's available in Arcgis Online. And this gives you an idea of total capacity. So not live updates of available beds, but total capacity of hospital beds, ICU beds. And then what they do is they update this periodically every week or every quarter on the actual utilization of those beds. So you get really nice kind of foundational data set to start building out your capacity planning. So this is a really good one where it has a blog on where that data is coming from and how to get access to it. Then there's some states, I'll go back to our friends in Florida. So this is coming out of the Florida Emergency Management Group, where they partnered with their own agency, ACA, which is the Agency for Healthcare Administration. They track all those hospital beds internally. So they have their own systems that they track that stuff. So they're putting out a dashboard that has occupancy rates per county and for the state, so they can kind of see when and where they're going to have issues over time. So really valuable information product to get this out and in the hands of maybe those county leaders, those health officials, to really look at where change is going to happen over time and where you have availability resources. Here's a really great example from our friends down at Cobb County, Georgia. They created an RTS Hub site, which is a really interactive way that you can, you host a website in there, you can put in your information products, and you can really drive things like crowdsourcing activities. And what they did here is they put together a crowdsourcing activity through Survey 123, which is just a form factor for crowdsourcing grocery store inventory. So the ever elusive toilet paper, you want to know where that's being sold or getting stocked right now, you can go through here and you can check where that is. No, there's probably not any because somehow somebody bought it all. But anyway, there's a lot of information here that that helps drive that crowdsourcing ability, and it gets the community involved in helping out. So I think this is a great way that a lot of our local communities can help pitch in and drive these information products. And they don't have to do all the work themselves. They're leveraging the citizens that are going to those stores and saying, hey, tell us what's in stock and what's not out of stock. And it's a really simple form that they can go fill out. So kudos to Cobb County for doing that. And then there's some other like interesting stuff. So I highlighted the definitive healthcare information. We have another partner called MCH Strategic Data. They're coordinating the collection of all school closing data for the US. Now this is coordinating by state, by county, and then down to individual schools, what's open, what's closed, and what's not. So really great data set that you can use in your planning activities. All right, so we mapped the cases, we looked at them over time, we put some demographics in there, we looked at capacity planning. Now we need to communicate with this. And this was shared with me by a colleague here that General O'Shaughnessy was giving on a Fox News update here. And what's really interesting about this is that he's got 8 dashboards behind him, all highlighting, all powered by Esri, all hiding different things going on in the country. Great way of kind of showcasing what's going on in the EOC and what they're really paying attention to. So really great way of communicating internally through maps. And this might, not all of these are public applications, but a great way of communicating what's going on. We're seeing this a lot in EOCs. Here's another one from our friends at DCH SEMA. This is a Homeland Security Emergency Management Group. And what they're doing is they're not just looking at DC, they're actually looking at the entire national capital region and looking at testing and cases and mapping that to what's going on in their fellow states. So this is one of the first regional ones that we've seen. We've seen a lot of state applications, state, what's going on in that specific state and the borders there. This is a great regional application, kind of showcasing all of that information into one and communicating what's going on because we're all affected by that. Here's another one. This is from the state of Maryland. They used our Arcgis Hub platform to share out their main coronavirus.maryland.gov site. There's a couple of states who have done that. Iowa is another one that built that on the Hub site. Great way of getting out information really quickly. The Hub is easily configurable. It's you can drag and drop information on here. You can include things like dashboards and information here, text cards, other social media links, videos. Really great way of getting this out. They built this in about 12 to 15 hours on a Friday before things really started getting heated up. And yesterday they sent out a public alert to everybody in Maryland that had a cell phone and link this site to it. So we saw a pretty big spike in usage after this one yesterday. So great job, our friends at Maryland, for building out this site here. So those are really the 5 steps of what we're really communicating. The 6th one that's growing is around economic indicators and what's going on there. There's a ton of new additional resources that Esri is putting out as free resources to really get started really fast. So it started out 2 weeks ago. We released these tools for the community to do exactly what I kind of laid out earlier, right? Map the cases, look at things like school closures, look at facility management, launch your own hub if you want to. So we built out a template so you can spin that up really quickly. We've seen almost 1,500 of our users spin that up. Yesterday, we launched a new set of tools for business continuity. And this is really for any public or private entity to use these. And you can look at what's going on in your day-to-day business. How many people are in the office? How many people are out? What's your facility look like? What are your hours for deployment? So this could be used by anybody for that continuity of operations. Some really free tools that you can use to really launch that information now. And you can follow some best practices here to do that. There's some great information going out on our blog. Here's a great one about how GIS departments can respond and what to do. Outlines a lot of the things that I outlined in this story map here, but gives you a little bit more of the step-by-step guide of what's going on. We've had a lot of new users come to our platform and need help on just doing kind of some basic stuff, like just mapping out cases and mapping out things or looking at things over time. So Esri put out, these are free tools on our learn.arcgis.com site for learn lessons. They're all COVID cases here that you can look at. Some of these lessons are 5 minutes, some of them are an hour, and you get all the software that you need and data that you need to really learn how to do this. This has been a valuable resource because this isn't really like, here's what the buttons do. This is more about, here's the theory, I need to analyze these cases over time. What do I need to do that? And it gives you kind of all the thought process, data, and tools to do that work. So that's a little bit of my time here. Thank you all for your great work. This too shall pass. I will leave it open for a question or two if you have it. John, I don't know if there was any questions in the toolbox, but
I only have one real quick question that came in, Anthony, but I'm going to throw out one for you. I know that there are probably a lot of folks who are in the audience right now that would love to go ahead and possibly even stand up something like this themselves in their own communities. What would you recommend for them to do? How would you recommend that they go through that process and leverage the resources you have available? Yeah,
there's tons of free resources on here. I would recommend going to this hub site that I have up top here. This will give you access to, if you don't have the software, you can put in a DRP request to get the software. Through that, that original COVID response, what we're doing is we're giving a complimentary 6-month subscription with 15 creator licenses and a desktop seat to create any of these tools that we want right here that I kind of outlined here. You can do any of these with that, and then you can get started on just kind of using the data that's out there. Johns Hopkins has put out the county level data for free that you can start there, and you can kind of build out and add in your own spreadsheets or whatever. Then you can build out tools like this. I feel like we've come a long way. I'm not a GIS guy, and I put this together in about a day through a story map. So I mean, there's definitely, the tools are there to get this done right. So I would go to this. You can even Google it, the Esri COVID GIS Hub, and this is where you can request assistance for software. And then there's tons of tools in here and resources to either get the data or get some of the apps that are there.
That's great. We did have another question that came in, and it was regarding how do we get past the privacy issues with case reporting?
Yeah, I mean, I've seen that come up a little bit. Right now, we're really aggregating to the county level. And so you're not really getting into HIPAA privacy laws. There is a great resource here on this section. This is from one of our partners here. Let's get to more resources. Sorry for all the scrolling. We have a great resource here from our friends at, what is this thing? GIS Inc. They have a product called MapMask, MapMask, and why can't I find it here? And what that does, it has, it's a tool for Arcgis Pro, and it allows you to roll up in a HIPAA compliant way and masking any kind of privacy or PII laws that you might have. So if you have address data, I would highly recommend using that information to, and I can't find it here, using that tool to mask that point level data and aggregate that up in a way that's spatially significant.
Great, great. The only other question I really have left is actually one for me, which was, will the recorded version of these sessions or any of these sessions be available? And then the answer is yes. Ideally what we want to do is we're recording all of these sessions. If you've registered for an event, maybe you weren't able to attend, we want to make sure we threw that out there and shared that with everybody. But that kind of dashboard is still something we're building right now to make sure that everybody can kind of get a chance to download the different sessions. So we thank you so much for taking part in today's talk. Anthony, thank you for being such a great presenter. We really appreciate it.
Thanks.
And I know we've gotten to the end of our time, and hopefully we will be able to get back to everybody else in the meanwhile. And
thank you. I hope everybody stays healthy. And I'll share this story map with you that you can share out with those recordings.
That'd be fantastic. Thank you so much.
Okay. All right. Thanks. Thanks, everybody.